there's really 3 ways that you can determine this active recall patient number. The first way, which is a lot more difficult and obviously not realistic, is you're going to stand in front of the dental office for 6 months and you're going to count how many patients come through the door. That's not realistic. You're not going to be able to do that. So what are you going to do then? You have 2 other options. The second best option, a little bit more difficult, but still the second best option, is to go and actually log into the computer system, look at the schedule, and actually count how many patients there were on the hygiene schedule for the last 6 months. If you have time to count how many were in the last 6 months, that's ideal. That's going to take a while. At least find a month and count how many came in that month. Don't just do a week. A week is not good enough because the numbers fluctuate so much from week to week. Get an entire month, count how many there are, and multiply that by 6. That's going to give you a pretty decent number of how many patients are coming back every 6 months. Now, there are some patients that are not going to be coming back for their recalls at exactly 6 months. So I do want you to take that into account. And so maybe don't times it by 6, maybe times it by 9. Just to account that some patients are going to come back at 6 months, some are going to come back at 12 months. So we'll average that out by 9, 7, 8, 9, kind of that kind of range. This isn't rocket science. Remember, the rocket science way is you stand and you count how many patients are coming in. This is an estimate. You're doing the best you can. Multiply it by 8 or 9. That's going to give you a decent idea of how many actual active recall patients there are at this practice.